Live from our studio in Lagos, Nigeria, this is Beyond 100 Days. I am Abosadi Adenio Adoremi. Today on the program, we'll take a look at health, and it's about the anthrax outbreak in Nigeria and the federal government's plan to curb the spread. But before that, let's bring you some news updates. We'll begin in Niger State, where another tanker explosion has occurred, this time in Kosobogi, a boundary community between Age and the Lapai local government areas. An eyewitness said 4 persons were inside the tanker at the time of the explosion. And the Niger State Emergency Management Agency is yet to release an official statement regarding the incident. This explosion comes just a week after another tanker explosion in the Diko area of Niger State, which led to the death of 98 persons. Talking security, troops of Operation Fasanyama have dismissed reports that wanted bandit leader Bello Turji has been captured. They said the terrorist is still on the run after troops carried out a raid on his camp. But this is coming days after the commander 1 Brigade Nigerian Army, Guso, told journalists that 20 bandit leaders were killed. Elsewhere, the Niger State Police Command says it is still on the trail of the man who stored explosives in his house, leading to an explosion that killed 3 people and left several others injured in Mashego. The Commissioner of Police, Ebenezer Dan Maman, spoke while parading the suspects in Mina. Chenemi Bameyi has more.
While parading suspects arrested for various crimes, the Commissioner of Police assured the public that efforts are ongoing to apprehend the man responsible for storing the explosives.
The police expect more from communities. You have rightly distinguished this incident from minors associating with bandits. We expect that community, long before now, should have known that that kind of business is done by that suspect who is on the run, and should have also given intelligence to law enforcement agencies.
The police also paraded suspects arrested for culpable homicide, vandalism of street lights and armored cables, and this young man that denied committing the crime he was arrested for. We only visited the area where they were fixing street lights, he says. Then the police began to pursue those working there, and we ran away too. But the policemen that chased us saw the houses we ran into, and they came and arrested us. They took us to the area command office and brought out these items and asked us to hold them for photographs as evidence. But truly, we don't even know where they got the items from.
We are working together with him. He now tell me that there is one war in Masuka site. When he called me, when I go there, he said this is how they are going to do it. When I tell my boy we should disconnect it, when we disconnect the line, he now say he's coming, the Jibrin. That we waited for him there, he now go and call vigilante, start beating us, that we are a thief, this and that.
This marks the first suspect parade of the year. The police emphasized their target to reduce crime by 50% through enhanced community partnership and proactive measures. Chenemi Bameyi, TVC News, Mina.
And in other news, the federal government, through the Ministry of Interior, is working out a plan that will produce a special squad to protect critical power infrastructure. The Minister of Interior, Olubunmi Tunji-Ojo, said this at a news conference in Abuja. In the first quarter of 2024 alone, the Transmission Company of Nigeria reported 5 significant vandalism incidents that disrupted transmission operations, necessitating emergency repairs and, in some cases, complete tower reconstruction. Let's now get into our discussion for the day. Few days ago, the Federal Ministry of Livestock Development confirmed the outbreak of anthrax in Zamfara State. Anthrax, caused by the bacterium Bacillus anthracis, is a zoonotic disease that can affect various warm-blooded animals, such as cattle, sheep, goats, horses, and wildlife, as well as humans. While anthrax is preventable through coordinated efforts such as risk assessment, surveys, and ring vaccination of susceptible animals in high-risk areas, prompt detection and response are critical to containing its spread. Now, what should the federal, state, and local governments be doing to stop the spread in other states of the Federation? Joining me for more on this is the founder, Love for Health organization, Dr. Yusuf Haroun. Good to have you join us on the program, Dr. Haroun. Let's get into the conversation. A lot has been said about anthrax, and of course, people are really worried because they want to know more. How dangerous is this disease called anthrax?
Yes, thank you very much once again for having me here. Anthrax is a zoonotic disease that is caused usually by infection or infected animals. In Nigeria, currently Zamfara State, the Agricultural Ministry confirmed the outbreak of anthrax. But before this year, in 2023, there was a case fatality rate of 13.1% anthrax among the cattle and about 13% among the sheep. But there was no recorded fatality case in humans. But it is very concerning that we should know that anthrax is a disease that can be deadly. And part of the symptoms we see or we face in people who have anthrax are fever, sore throat, skin rash. You could have bleeding, which is also called hemorrhage from the orifice, like the mouth, the nose, the anal part. Then also they can have cough. And that is why anthrax used to be called wool-sotter's disease, because it affected the lungs of people who are infected with anthrax. Anthrax is called Bacillus anthracis because it is caused by a bacterial disease. It is a case of a World Health concern. 2023, when Nigeria was infected with anthrax by some animals, when there was an outbreak in Niger State, in Okuoba, even in Lagos State, there were recorded cases of anthrax in 2023, just 2 years ago. 2 weeks prior to that, in Ghana, there was also a case of an anthrax outbreak. So it is a world concern in food and agriculture. Anywhere there is an anthrax, everybody has to be concerned about it, and it has to be reported to the World Health Organization and also to the Food and Agriculture internationally, so that it is gotten rid of and it is arrested immediately.
All right, and I guess, that's what is already taking place, especially with the situation in Zamfara State. The federal government is very much aware of the World Health Organization is also involved. But talk to us about how this is transmitted to humans. Quite fortunately, we haven't heard about any human casualty as of now, but then we understand that it can also spread to humans. So how does this happen?
Okay, so I can't actually hear the question well, but I assume what you said, if you can hear me, is that you were asking how we can prevent it or how we can regulate it.
Well, not yet talking
I'm trying
prevention.
to read your lips, but I can't hear very well here.
Okay, I'm talking about how the mode of transmission to humans. It's a zoonotic disease, but we understand it can also spread to humans. So how do humans contract this disease?
Very, very, very important question. Now I can hear you well. And it is a zoonotic disease. Zoonotic diseases literally or technically mean that they are transmitted from animals to humans. And the commonest way in which humans can contact this disease is by consumption, eating it orally. So this is the commonest way. Other ways in which humans can contact it from animals are by the herders or the farmers who are living with these animals that have been infected. Now, I want to make it clear that this anthrax disease, it's a bacterial infection, and it is naturally occurring in some soil. So when these animals consume some food crops, like they consume grass as they are eating, they can get infected with the anthrax. The way to do it is to immunize these animals. So there are vaccinations also to prevent them from anthrax. So these humans, if they consume animals that have been infected with the anthrax, they also develop the infection and start to develop symptoms. that I have described earlier, which include skin rash, sore throat, cough, bleeding from the orifice, like the mouth, the nose. They can bleed from the ears. They could bleed from the private parts, hemorrhage. So these are part of the symptoms or signs that you find. So the commonest way in which humans contact this disease from animals is by consumption of these animals that have been infected with the anthrax, or the farmers or herders that are living in close proximity with animals that are already infected with this infection, with the anthrax, and they contact it. So the organism that causes it, it's Bacillus anthracis. It's a bacterial infection.
Okay, now that you've spoken about the fact that humans can contract it by eating, an animal that is infected, we know that veterinary doctors have actually advised against eating animals that die suddenly. But then, how would unsuspecting members of the public know which animal died suddenly when the meat would already be packaged, as in the case of frozen chicken, for instance?
This is where the federal government comes in, and the Ministry of Agriculture. All animals that are going to be sold to the public for consumption have to be scrutinized. Animals that die suddenly should be avoided by humans to be consumed, because we don't know the kind of infection that will have caused this particular animal to die suddenly. The proper way internationally to consume any animal is to slaughter this animal in a hygienic way, according to the standard and the rules and regulations in that country. After that, they should be cooked. This animal also, or this meat, should be cooked properly before they are consumed, because even consumption of raw or improperly cooked animal can also lead to infections to these humans. Apart from anthrax, we also have worm infections. We could also have different kinds of things which humans can be predisposed to. So proper slaughtering of the animal, proper cooking, and the Food and Agricultural Administration, or Ministry of Food and Agriculture, should ensure that all meat that is in the market are properly scrutinized. So there can be a random screening. For example, you go to the abattoir, or you go to where animals are being slaughtered and inspect them. Also, I encourage random inspection in meat shops to see what they are doing. Also in eateries, in restaurants, some people just pick up dead meats and cook it for people to eat. This is posing a high risk to the humans and also to the people in the society in contracting this type of infection, which should be avoided and which can be avoided and which has even been eliminated in developed countries. So why is it still here in the tropical countries? It's something which we can do. It's just a lack of will, not only political will, but also personal will. Some people don't want to lose. I'll give you an example. Somebody who has spent hundreds of thousands or millions to buy animals, and now this animal has contracted anthrax. This farmer becomes very greedy or selfish and looks at it that if he just discards this animal without selling the meat to a nearby meat seller, he's going to lose millions. So he wants to make profits. Because of that, he would go behind and sell this meat to a local person who will buy it for a cheaper price compared to the standard price, and they will cook this meat and serve people in restaurants or in a party to eat. And that is how they can get this infection.
All right, Dr. Haroun, we'll take a break. When we come back, my first question to you would be about, cooking. If there is a way that cooking this meat could actually transform it from being infected to, something healthy for consumption. So let's take a break, and when we come back, the conversation continues. Please stay with us.
I'm Miriam Lunge. I'm a passionate environment advocate and a published author.
I am the founder of Celebration, a businesswoman, and a fashion icon. I am a wealth coach and a real estate developer.
I am Amako Arakwe. I'm a corporate commercial lawyer and an entrepreneur.
Barka mu da warhaka. I am Ramatu Shehu Oyibo, an entrepreneur and a business coach.
I am the voice of an average Muslim woman, an hijabite, and a lawyer. I am a polymath and a serial entrepreneur.
I am Murayo Afolabi Brown, Managing Director, TVC Entertainment. I'm a media consultant, producer, and broadcaster.
The ladies of your view are made of women from different professions, tribes, cultures, and religion. Join us every Monday to Friday as we share our views on topical and social issues.
Today on the program, we are discussing anthrax and what can be done to prevent further spread of this zoonotic disease. And my guest is founder, Love for Health organization, Dr. Yusuf Haroun. So, Dr. Haroun, there's this belief we have that if you cook something, you boil it, there's the likelihood that whatever germs or dirt that might exist in it, might be killed in the process of the cooking, with anthrax, does that apply?
The answer is capital no. It doesn't destroy the spores. Now, remember I said that this anthrax is caused by bacteria, Mycobacterium anthracis. Now, these bacteria have spores. These spores that are produced by the anthrax are highly resistant to heat, to cooking temperature. So even if you cook this meat that is infected with anthrax, the spores are still active. And once these spores are consumed, they have a high tendency of causing what is called gastrointestinal anthrax, or it can cause respiratory anthrax disease, which we have been calling Wool-Sutter's disease or respiratory problems. This person can later develop hemorrhage, breathing difficulties, temperatures, fever, and in severe cases, it can be fatal. This person can die. So the advice is any meat that is suspected to have been contaminated with anthrax or any animal, that animal should be completely eradicated. Also, there's what we call quarantine or screening. If one particular animal in a herd of animals or herd of sheep or goats or a rams, is one animal is found to have this anthrax disease, it is best that you quarantine the remaining ones, and you are going to also test them to make sure that they are not also infected with this disease. So cooking a meat that has been contaminated with anthrax doesn't guarantee that the infection is going to be eliminated. In fact, they still have spores, and these spores are resistant to normal cooking temperature, and they can still cause infection. So if we see any case of anthrax disease, it is best and safe that they are reported, or the cases are reported to the local health authorities, so that proper public health measures can be taken to prevent a widespread or an epidemic in our society or in the country at large.
Okay, so is there a cure for anthrax, whether in animals or humans?
So vaccination is it. Animals are usually vaccinated, and that is why animals that, if someone wants to set up a farmland, it is proper that this farmer is registered under the Food and Agricultural Ministry, so that this farm or these animals take proper vaccines, not only anthrax. They can also be infected with worms, they can be infected even with tuberculosis. So the milk in which these animals are produced also, if they are not properly pasteurized, and if these animals are not properly screened and are not even taking some vaccines or some treatment, someone can even drink this milk and contact infection, such as tuberculosis and all other forms of infections. So it is best that animal husbandry or animal farming go through the normal public health screening method. They should be registered under the government. All animals should be screened. The people who are also rearing these animals should be medically tested. This environment in which they are using should be safe and free from infections. So I believe it is a collaboration between the government and also the people who are rearing these animals. In addition, the farmlands and the shops also, or the meat sellers also, should also be screened to make these meats in which they are selling to the public are not infectious, or they don't cause a public outbreak in the society. So these are part of the measures in which the local community can take to prevent free and safe environment, and we don't continue to break down with infections such as this anthrax, which can become an epidemic if it's not properly managed.
All right. Earlier,
so prevention is better.
Prevention is better than cure, definitely. You know,
Absolutely.
earlier you were given an example of a farmer who's maybe heard of cattle, you know, develop maybe one or more develops, you know, anthrax, and you were talking about the person who could, out of, do I call it self-pity now, want to just, you know, sell these despite the knowledge that, you know, there's something wrong with that animal. What do you think government can do to support those kinds of farmers? Because for them, it's just like their investment is going down the drain, and they are concerned because they do not know where to pick up from if all of these animals are gone just like that.
Absolutely. That is why I strongly encourage that there should be subsidized farming. The government should encourage farmers. There should be local farmers, and there should be funding also. For example, if I know that I have herds of cattle, as an example, and some or one of them is infected with an anthrax, I know that if I report it to the government sends a public health team to confirm this, I will be compensated for this. Then I will be honest enough to report any case like that because I know there will not be loss. But in a case where the farmer has to bear the whole loss of this burden, he will not be honest. He will know that if he just declares that one of his animals is infected with anthrax, he is going to lose a lot of money, and he may have spent millions of naira to particularly to get these animals and to also rear them. So I encourage strongly that the government should do more. They are doing already, but they should do more to support the farmers and support those who are rearing animals, to screen them, to send health workers to quarantine the animals that are infected, to make sure that these animals in which they are rearing is free from infections, especially anthrax, which we are talking about, and which there has been an alleged outbreak in Zamfara State before it goes to Niger State, comes to Lagos State, because most of these animals we are eating, they are reared in the north, and they are shipped down to the south, especially now that we are getting close to season where we are going to be slaughtering animals, and we're going to be eating them more. So I encourage the government to work with private farmers also to provide proper screening of animals and to prevent the outbreak of anthrax, which is a public concern, and it's also become an epidemic.
Okay, and we know that some states have actually begun mass sensitization and vaccination programs. Are these effective, you know, in driving the required change? Or what more can be done really to drive home this message?
Vaccination is very important. For example, in 2023, about 13.1% of cattle were recorded, 13.1 cases per death. So when there's vaccination, the case can drop significantly to even less than 1%. That is the impact of vaccination. It's very, very effective. So I encourage that there should be more vaccination, there should be more health sensitization. And even if there's anyone who has been infected with anthrax, there is treatment for it. It does not mean that it's a life sentence. No, there are antibiotics that the person can take, antibacterial medications which the person can take. And also through a veterinary doctor, animals that are infected with anthrax can also be treated once they are detected early. Early detection and treatment can save a lot of lives and can also stop the spread of this infection to healthy humans and animals. So it is very effective. Public health awareness is very effective. I'm going to say this as one of my closing remarks, that if we invest more in public health, we are going to have less hospitalization and treatments in our tertiary and secondary hospitals. That is government hospitals, general hospitals. If we invest more in the primary health care, but in our society or in Nigeria, it is the irony. Less people go to primary, more people go to tertiary. So that is called a failure of prevention of disease. So we should try to prevent these diseases so that they don't become complicated and we have to be looking for treatment. Instead of looking for treatment, let's start looking for prevention. which is better than cure.
All right, Doc. You know, when you mentioned antibacterial medication earlier, I wanted to also chip in that no self-medication. It should be reported to the authorities and let them prescribe what is necessary in every situation. Founder, Love for Health Organization, Dr. Yusuf Haroun, thank you very much for helping us better understand what anthrax is and what we can do as a people and as a nation to prevent further spread. Thank you for your time.
You're welcome.
Well, that's our program today. What to repeat broadcast at midnight and at 6 a.m. I am Abosadi Adenio Aduremi. Have a great day ahead.